Hi guys, today we'll be talking about depression. It is one of the diseases that has a huge burden on our healthcare system. Depression, according to ICD-11, can be defined as a state of low energy, low mood, and lack of interest in any activity. The presence of two out of these three features is classified as depression. According to DSM, depression can be diagnosed by the presence of 5 out of these 9 clinical features, which includes depressed mood, less interest, which is also called anhedonia, presence of guilt, there is a persistent low energy state, the sleep cycle is usually disturbed, which includes early morning awakening, concentration levels are reduced, appetite is usually reduced, which thus causes weight loss. There is psychomotor agitation. For example, the person gets agitated on small topics, small inconveniences, and the person has also increased risk of self-harm. Another term you should know about is dysthymia. Dysthymia is very low and mild sadness, but which has persisted for more than 2 years. Chronic major depression is a depressed state persisting for more than 2 years. There is a difference between depressed and very mild sadness. There are two peculiar facial features often seen in patients of depression, which are omega sign and Veraguth folds. Omega sign. This sign was described by Charles Darwin. It is due to the contracture of procerus muscle and corrugator muscles. The other sign is Veraguth folds. It was described by Otto Veraguth. It is kind of wrinkles around the upper eyelid on the inner side. It is due to contracture of orbicularis oculi muscles. Here I am attaching a picture depicting the omega sign and the Veraguth folds. Depression can further be classified into typical depression and atypical depression. The features of typical depressions, as we discussed, includes digest gaps. But in atypical depression, the person eats a lot, which causes obesity, and the person also sleeps a lot, thus hypersomnia. The person is very sensitive. Even small things trigger a response in him. He is emotionally labile. The other features include laden paralysis, which is the person does not have any will or motivation to move about. The person just sits around the entire day. And the person suffering from atypical depression does not respond to the conventional drug therapy, which is tricyclic antidepressants. So, the drug of choice for atypical depression is monoamine oxidase inhibitors, followed by SSRIs, which is selective serotonin reuptake inhibitors. Next, we will be talking about how depression affects the central nervous system. The neurotransmitter levels, serotonin, norepinephrine, and dopamine, are reduced. The neuroplasticity, BDNF, and the number of synapses in the brain also decline. And there is an increase in the inflammatory process in the central nervous system. There is a triad associated with depression, which is cognitive triad, which includes negative view of three things, that is self, world, and their future. There is a named triad in depression, which is Ehrenbach's triad, which includes the features of helplessness, hopelessness, and worthlessness. Next, we'll be talking about some causes of depression, like drugs, which includes beta blockers, oral contraceptive pills, interferons, which can precipitate acute ideas, barbiturates, and also steroids. Steroids can cause both depression and mania, depending on the individuals. Some medical conditions often associated with depression are hypothyroid state, vitamin B12 or folic acid, or vitamin D deficiencies. Chronic medical illnesses can also precipitate depression. Chronic pain syndromes can also precipitate depression. We will be talking about management of depression. So, if you recall, how was depression caused? It was due to decreased levels of serotonin. So, our first line drugs include SSRIs, which increase the levels of 5-HT, which is just another name for serotonin. The examples of it include fluoxetine, which is also one of the most safest and most commonly prescribed SSRI. Other examples are paroxetine and sertraline. Adverse effects include GI bleed, which can be prevented by using proton pump inhibitors. Where else did we use proton pump inhibitors? In H. pylori. The other side effects include sexual dysfunction, nausea, vomiting, diarrhea, and vivid dreams, and often it can cause insomnia. There is an increased risk of paradoxical self harm with SSRIs because in depressed state the person isn't motivated to do anything, but once we start SSRI, the person suddenly gets the motivation to take a decision and take steps on a thought that has preoccupied his or her mind, and thus causing self harm. The other drugs include SNRIs. SNRIs are selective norepinephrine reuptake inhibitors, which increase levels of both serotonin and norepinephrine. The examples include duloxetine, venlafaxine, and milrazepam. You can remember duloxetine as dual increase, which is both serotonin and norepinephrine. These are also used in chronic pain syndromes. Another drug that is used is bupropion. Its mechanism is by increasing norepinephrine and dopamine levels. It is also used in nicotine cessation. The side effects include decreased seizure threshold, insomnia, and it is also anxiogenic, that is, it causes anxiety. There is another drug which is called California rocket fuel. It is a combination of venlafaxine and mirtazapine. Mirtazapine is also used to treat insomnia with depression. Regarding the duration of treatment for depression, the effects usually start to show after 2 to 3 weeks of medication, and you do not stop the treatment until after 9 to 12 months of the last episode of depression. Maximum withdrawal is seen in drugs like paroxetine, venlafaxine, and desvenlafaxine. The most safest and commonly used drugs are fluoxetine, bupropion, and agomelatine. For mild to moderate depression, usually drug therapy is not required. It can be treated by cognitive behavioral therapy, interpersonal psychotherapy, solution focused psychotherapy, and psychoanalytical therapies. Long-term use of venlafaxine and desvenlafaxine has associated with side effects of increased chances of hypertension. Another drug that is used is trazodone, but it has a side effect that is priapism, which means prolonged and painful erection lasting usually more than 4 hours and caused without any sexual stimulation. World Mental Health Day is celebrated on 10th of October each year, and there is also a specific term which is Blue Monday. It is used in United Kingdom to describe the third Monday of January as the most depressing day of the year. Depression is a debilitating illness, so if you or anyone you know is suffering from it, kindly encourage them to go for psychiatric consultation and psychotherapies. Thank you for watching, guys.